Delegate Price.
Page 385.
Thank you, Mr. Chairman and members. I would like to start with item 311, number 6H. Sorry, I don't have page number.
We're fine. Go ahead.
Okay, and this is a trigger warning for those that might be watching. This is about suicide prevention. For suicide prevention, social media platforms can help share crisis lines and educational resources, offer help, and share personal stories. The CDC recognizes that social media is filled with promise for health communication, and the field of suicide prevention can capitalize on these opportunities in the following ways. Quick dissemination of health and safety information, leveraging user networks to amplify info, sharing to broader and more diverse audiences, making health messages personal and relevant for intended audiences, facilitate interactive public engagement, and empower users to make safer and healthier decisions. The requested amount is based on an estimated $250 per day for 365 days for a large-scale social media campaign, and $90,000 salary for a digital project manager to message mental health and emotional intelligence content in consultation with Virginia teenagers, co-creating meaningful content using their colloquialisms and proclivities, not using toxic positivity, but real, genuine, and authentic content that can be heard and felt by them, hosting focus groups, internships, surveys, and open dialogue with young influencers. Mr. Chairman, currently the DBHDS has 5,800 followers, 5,800 followers on Facebook, and one post in the last month about suicide. They have 2,000 followers on Twitter, and the one post about suicide last month was a retweet. The last one of their own tweets specifically about suicide prevention was November 30th. The Virginia Department of Health has way more followers on Facebook, but no posts in the last month about suicide. Twitter looks better for size of following, but the engagement numbers are low, and neither of them are on Instagram. Last year, I was told this budget amendment was not needed because the department was already doing this, and that may be true, but obviously we need to do more in conjunction with the targeted population. We must embrace that there are differences between announcements and active digital outreach. This $181,250 will be funds for active outreach aimed at addressing the rising levels of death by suicide amongst our teens. The second one I'd like to highlight is item number 313, number 3H. And this is a pilot program for students with autism. In Newport News, there's a coalition of organizations supporting students with autism. They all have children or family members with autism and are keenly aware of the gaps in services that are available. This budget amendment for $100,000 would allow for them to establish a pilot program, creating workshops, activities, trainings, and supports for families in the community experiencing these gaps. For instance, families have reported that school systems across the Commonwealth still do not have extracurricular activities that fully involve their students with autism. These funds will be for programming, staff and training development, capacity building, and a structure that could easily be integrated into our local school system and city parks and recreational department activities. These organizations are uniquely qualified and positioned to do this work, and these funds will be crucial for the residents who need more services for their students with autism. And finally, Mr. Chairman, I have item number 408, number 2H. Thank you, Mr. Chairman. We have had a very public discussion about the best ways to curb gun violence in our communities. Both Operation Ceasefire and the Virginia Firearm Violence Intervention and Prevention programs were funded. We warned about the differences in approaches and the negative impacts that mass incarceration can have on communities. Even with that, millions of Operation Ceasefire funds were given to enforcement strategies only when it's proven that prevention and intervention are what can help stop violence. The failed policies of the 90s did not work then and will not work now. We can't arrest our way out of this situation because if we could, the current and previous rates of incarceration in this country and Commonwealth would almost certainly have us with no instances of gun violence. But we know that is not the case. This budget amendment costs nothing, but would redirect the proposed $20 million from one pot to the one that is actually focused on prevention and intervention and proven strategies for community organizations to do this work. Thank you, Mr. Chairman and members.